We have been talking about a lot about virtual care and telehealth, and it's extremely important that you understand what the personal benefits are for this particular technology. It is extremely important when you're choosing your medical subspecialty to understand the impact of telehealth today, and more importantly, how it is going to be part and parcel of the whole ecosystem of healthcare delivery in the future. So there are significant personal benefits that you can actually think of in terms of virtual care and health delivery. Hi, I'm Junaid, neurogroup stroke and epilepsy specialist, and today we're going to talk about the personal benefits, and one of the key issues that we're going to talk about are the 4 C's. The 4 C's include continuity of care, convenience, cost, and comfort. Now everyone knows about convenience, cost, and comfort, so let's go through it quickly. Now clearly there's a significant amount of comfort that goes with it because the patient is in their own personal home environment. And when they're in their home personal environment, they are able to be more free, they're more accommodating, especially in terms of psychiatry, etc., to be able to divulge into those sensitive stuff as important. For me as a neurologist, it's extremely important how to see their personal environment as well, because I'm majorly concerned about fall risk on my multiple sclerosis patients and my epilepsy patients, or even dementia patients, if they actually have an appropriate process of taking their medications itself. So clearly, comfort is one thing, but more importantly, it actually helps the physician and the patient to get better care. Similarly, the cost goes down. I mean, there's no babysitting cost, there's no cost for patient to park, there's no patient time to take off, etc. And it does not only apply to the patient only, because the biggest issue comes in for the caretaker too. Because if there's an 80-year-old gentleman with Alzheimer's dementia, the daughter or the son has to take time off, go pick the patient up, and then come back. If there's a telehealth application, I can do a 3-way call and I get the most important information with the patient, because God forbid if the granddaughter or the grandson is not available to come, that basically visit is useless because I have no good information to make the management changes. So I get accurate information as well. So not only comfort and convenience for both patient and caretaker, it is definitely low on cost, because clearly, as we discussed in the environmental impact, just by with the gas prices going on right now, we save on gas only, if nothing else. So clearly there's a cost that is decreased. Now let's talk about the elephant in the room, like why should the virtual care visits be cheaper for the patient as compared to real world in-person physical visits? Clearly, there is definitely a lower cost attached to it, even for the practice itself. I mean, technically there's low electricity, there's low usage of internet, computers, heating, etc., and possibly there are now 100% virtual clinics. Now 100% virtual clinics may be a separate story, but overall, the cost, to be honest with you, the reimbursements are falling quite a bit for physicians, nurse practitioners, clinicians in general, and they have not kept up pace with the inflation. So I don't know what to make of that. But more importantly, my student loans haven't changed, right? Because I'm going virtual care. The biggest cost at the end of the day is human resources, which basically means that I still have to hire a nurse practitioner, I still have to hire a nurse. So overall, it is a contested debate that should the virtual care visit be cheaper. Interestingly though, if you look at the market, there are ways that people are actually even completely not going through insurance companies, because literally getting through the insurance companies, going through the billing process, waiting 90 to 120 days to get reimbursement from insurance companies, they're just saying cash pay, and then generally that cash pay is better for the patient and the physician, believe it or not. So clearly, when you have virtual care, you can actually have access to care that is highly specialized that you don't have it. For example, a small area within the state of Arkansas can get highly specialized epilepsy care now through virtual care that was not possible before. And more importantly, it will definitely be cheaper, because at the end of the day, what is your alternative? If that physician is charging the same amount, you still are saving a 100-mile drive to Dallas, Texas, supposedly. So clearly there is definitely still a lot of cost savings that are going on in terms of that. But my basic concern and my important thing is continuity of care. Now, clearly we actually are not prepared from a logistic and regulatory environment to be able to have continuity of care that is truly what digitized healthcare can provide. So for example, if the person is actually in Dallas, Texas, and the patient unfortunately traveled from, I don't know, let's say India or Philippines or Pakistan and got care into the hospital over here, and then goes into the rehab and then finally moves back to India. Now those documents need to travel, and there's a significant amount of loss, especially nuances that are extremely important in creating a proper care plan, an individualized care plan for that patient. That whole nuance can be lost. However, if that particular physician is providing virtual care, the patient can get the same care from the same patient at the same level with proper memory of how the care was provided into these patients, with significant amount of accuracy and decrease in repetition, complications, etc. Because that physician actually knows everything. And if nothing else, and if that particular physician is actually not able to provide care, at least with virtual care, they can actually talk to the physician back in India, Pakistan, Philippines, wherever, and then make sure that that care is actually provided appropriately. Let me give you a personal example. So there was a family friend that unfortunately his father had a stroke, and that ended up initially happening in Atlanta, Georgia. I was not the treating physician, but I was helping the family out because they were family friends. Then they got the initial care, they got a stenting done, and then that stenting required a little bit of intra-stent thrombosis, and that intra-stent thrombosis required antiplatelet adjustments, and they were asking me questions. Unfortunately, the patient had to move from state to state. So first, initially, he was at the son's house in Atlanta, Georgia, but then they moved to Dallas, Texas, which was her daughter's, which how I knew about that particular patient. And then from that Dallas, Texas, ended up going to the second son's house, which interestingly was in England, actually right out of Manchester. And then finally the patient moved back to Pakistan. That patient moved to 4 cities on 3 continents. It is interesting that how people do move around in this global world, but why the care does not follow through. Now, I am licensed in Atlanta, Georgia and Dallas, Texas, but I'm not licensed in Europe. I'm not licensed, actually I have an active license in Pakistan, but interestingly I may not be licensed in, from India, because the question really becomes that how do you provide care from a regulatory and a logistic environment? And this is going to change because we are looking at more and more regulation and regulatory environment getting more feasible, more attractive for virtual care. And by the way, in the 10 years that we see this, we're going to have a system like VA does. VA doesn't care which particular one state you have a license from. As long as you have a license from one state, VA will, you can provide care at all VAs, because that's a federal hospital. And therefore, if you're at the federal hospital, it doesn't matter which state license you have. So we're going to see a lot of regulation, a lot of legislation pushing forward in the next 5 to 10 years, where physicians and even nurses, nurse practitioners will be able to push care into multiple states. Again, very grateful for your time. We're going to talk about impact of COVID on virtual care in the next session. Thank you.